Hello guys, welcome again to another episode of the Cure for HIV. Today I'm visiting a facility and like I said the other time, today we're going to be talking about STIs and how it affects HIV. Here, STI and how it affects HIV or how it can lead to HIV. So just stay tuned while we ride on. But before then, let's pay a close attention to what STI and RTI are.
Welcome to Unit 1 of this STI Awareness and Prevention module. In this unit, we will look at the impact of STIs and RTIs on maternal and perinatal morbidity and mortality, and the role of clinical services in reducing the global burden of health. By the end of this unit, you will be able to explain what STIs, RTIs are and why they are important, describe how STIs, RTIs present and outline the clinical impact of STIs, summarize why good clinical practice is needed. Reproductive tract infections, or RTIs, encompass all infections of the reproductive tract. Curable sexually transmitted infections, or STIs, such as gonorrhea, chlamydia, syphilis, and trichomoniasis, are RTIs that are primarily transmitted through sexual contact. Not all STIs affect the reproductive tract, and not all RTIs are sexually transmitted. STI refers to the mode of transmission, whereas RTI refers to the site where the infections develop. Curable sexually transmitted infections, or STIs, such as gonorrhea, chlamydia, syphilis, and trichomoniasis, are reproductive tract infections, or RTIs, that are primarily transmitted through sexual contact. STIs cause a large proportion of the global burden of ill health. WHO estimates that over 374 million new cases of curable STIs occur among people aged 15 to 49 worldwide each year, including 129 million cases of chlamydia, 82 million cases of gonorrhea, 7 million cases of syphilis, and 156 million cases of trichomonas. Viral STIs are also common. There are an estimated 417 million people with herpes simplex virus type 2 or HSV2 and 291 million women with human papillomavirus or HPV. Unlike STIs, many common RTIs are not routinely spread by sexual contact. Endogenous RTIs are caused by an overgrowth of microorganisms normally found in the reproductive tract of healthy women. They are not usually sexually transmitted, for example, bacterial vaginosis or vulvovaginal candidiasis, also known as yeast infections. Yeast infections can particularly occur following antibiotic use. Iatrogenic RTIs can result from poor infection prevention and from medical procedures such as IUD insertion, unsafe abortion, or other gynecologic or obstetric procedures. For example, the management of pregnancy complications resulting in infection of the uterus, fallopian tubes, and other pelvic organs. Please note that candidiasis and bacterial vaginosis can be sexually transmitted, and bacterial vaginosis in particular is often seen in women with multiple sexual partners. The challenge for clinicians is differentiating between treatment for vaginal discharge for gonorrhea and chlamydia and trichomonas, vaginalis, and bacterial vaginosis. This is because the symptoms noticed by patients and even the clinical signs of STIs and RTIs can overlap, closely mimic each other, or coexist, especially in women. Therefore, the clinical management of curable STIs is critical to ensure that practitioners can correctly identify and manage these important infections. Let's now look at STIs and RTIs in more detail. STIs are reproductive tract infections that are sexually transmitted. They affect both men and women and often cause complications if not treated. Common RTIs are not spread by sexual contact. They are caused by endogenous or iatrogenic infections, and they affect women more often than men. In women, overgrowth of endogenous microorganisms, normally found in the vagina, may cause an RTI, such as yeast infections or bacterial vaginosis. These overgrowth infections are especially...
So guys, thank you for watching and see you in my next episode. If you like my videos, kindly give me a thumbs up and don't forget to subscribe to my YouTube channel. Just hit the notification bell for notification. Hit the subscription bell right up there. It's written with a red pen or red ink. So guys, thank you and bye.